Paris, thank you. The pandemic has forced all kinds of workers to adapt, and that includes various medical fields like those in dentistry. As dentists across Illinois experience staffing shortages and an increase in dental appointments, they're asking state officials to consider teledentistry and other services to help meet the demand. Joining us now with more are Dr. Scott Tomar, a dentist, professor, and an associate dean for prevention and public health services at the University of Illinois Chicago's College of Dentistry, and Dr. Kirk Narayan, communications chair of the Illinois State Dental Society. Thanks to you both for joining us. Dr. Tomar, let's start with you, please. Dentists across Illinois, we know that they are experiencing a staff shortage amid this pandemic. Have you yourself experienced that, and how are you handling it?
Yeah, it's affected not only private practice dentists, but it's something that we're experiencing in the College of Dentistry, and I know most of the federally qualified health centers that we work with are having the same struggles. I think that there's no magic bullet to solve this, but I know our organization and others are trying all kinds of interesting and innovative approaches. Everything from starting their own dental assisting programs to in the college we're starting an internship program trying to bring folks into dental assisting to help us with our acute staffing shortage.
And you said that the college is experiencing the shortage as well. How is it affecting them? How you all there?
Well, it's creating the same problem that private practice dentists are having. That we currently have a shortage in many clinics of dental assistants. So it just slows things down, and our student dentists are not able to work as efficiently when we don't have adequate support staff. So again, we're trying a number of innovative things to try to bolster that.
And Dr. Narayan, your organization is calling for legislation that introduces teledentistry. First, tell us how that would work.
Well, there's basically two main changes that we're looking to propose here. One is to expand the use of teledentistry, and the other is to address the workforce shortage issue. So when it comes to expanding the use of teledentistry, we're looking to have the dentist be able to delegate limited care to dental hygienists and dental assistants while maintaining high patient safety standards, and also addressing the workforce shortage by allowing dental assistants to provide more patient services under the direct care of a licensed dentist after receiving approved training.
Now, we know that there's been some concern about that from opponents, that it might be difficult to do this. How do you respond to that teledentistry is effective?
Well, first off, we're advocating for people to have the appropriate level of training to be able to offer these services. So when it comes to like a dental assistant being able to offer some of these services, we're looking at, them going through some type of continuing education program that's approved, or going through a dental assisting training program that's approved by the Council on, the Commission on Dental Accreditation of the American Dental Association, or programs approved by the Illinois Department of Financial and Professional Regulation. So basically, we're looking at being able to have appropriate staff trained to be able to accomplish these procedures.
Now, according to a 2021 study from the American Dental Association, about 86% of dentists said recruitment of dental hygienists was challenging, and about 83% of dentists said that recruitment of dental assistants was challenging, and more than 70% said that recruitment of administrative staff was also challenging. Dr. Narayan, based on your organization's research, what have you heard from dentists about the recruitment process?
Well, it's really quite challenging right now across all aspects of dentistry. In particular, we're aware that 5% of dental hygienists have left the practice of dental hygiene, and they have not returned to work.
And Dr. Tomar, today, Illinois U.S. Senator Dick Durbin urged healthcare providers, hospitals, universities to publicize this $1 billion scholarship and loan repayment program for workers entering these fields where there are shortages and limited resources. How could that help dental workers and with recruitment and staff?
I think it's certainly a step in the right direction. There's a national program, the National Health Service Corps, but state program, adds to that. I'd say, it certainly helps us try to recruit dentists and dental hygienists to underserved areas. But I think we really have to go beyond that. One of the things that we see in Illinois is, at least in terms of the number of dentists, we're actually fairly well supplied. But we have about the 11th highest dentist to population ratio in the country. But we still have 75 of the 102 counties in Illinois that have a dental health professions shortage area. So part of it, I think, has to do with recruitment as well as providing scholarships and loan repayments. We have to try to recruit people from areas that are underserved with the hope that they will return to those areas to provide care.
And Dr. Narayan, before we let you both go, what more would you like to see maybe from policymakers or the government to support what you all need in about 20 seconds?
Well, I think the biggest thing is for us to really get this bill passed through the Senate and the House. We really need to expand the scope of teledentistry to get the access to care moving along, and also to help alleviate some of the stress on the system right now by trying to utilize teledentistry whenever we can.
Okay, Dr. Kirk Narayan, Dr. Scott Tomar, thank you so much for joining us.
Thank you, Brandon.
Thank you.